In this episode of Cure Your Fatigue with Morley Robbins, Morley interviews Will and Susan Revak, who own OraWellness, a company dedicated to your oral health, including your teeth and your gums.
Well, Susan and Will, it's an absolute delight to have you on the show. Appreciate you taking time out of your day to be here. And we're just so excited to get your perspective on the world and what you can bring with your unique focus, but also you've got some amazing products. So we're really excited about that. So I'm not sure who to start with, but we'll do ladies first. So Susan, just give us a quick update about how you all came to be focusing on this and what's the story of origin for your focus.
Sure, of course. First of all, thank you so much, Morley, for having
Yeah.
us here. It's a real
Oh,
treat.
yeah.
I've had the benefit of having exposure to you through my brother, Dr. John Cotter,
Right.
and he's invited me. I've attended a couple of your monthly meetings, and it's
Oh,
always
that's
a
great.
delight to
Awesome.
learn from you. So thank you.
Well, he's one of
Um,
my heroes. I want you to know that. So he's a
yeah,
pretty special guy.
yep, I agree. One of mine too.
Yeah, I bet. Yeah.
Yeah. So, Will and I started Oral Wellness basically based upon my life experience of getting a diagnosis when I was 30 years old. We had just moved to a new town, and so I went to a new dentist. And despite the fact that I'd been going to dentists my whole life, this
Mhm.
new dentist said basically, Susan, you have a advanced case of gum disease in one pocket around,
Wow.
one of my molars, wisdom teeth area. And, I'd never heard the term before. I'd never even
Yep.
heard a dentist tell me I had gingivitis or anything like that. I had some
Mhm.
conscious awareness that there was something going on. I knew
Right.
there was a smell that was there, so I would
Right.
brush my teeth
Yep.
a little more often. And what happened in that appointment was the room got very gloom. The dentist started emanating and expressing this energy of, oh, this is bad, which
Oh, God.
shocked me. I didn't
Yep.
know what was happening. And she
Right.
handed me a brochure that had a picture of some half of somebody's face basically rotting off.
Oh my
And
gosh. Oh, that's
she
horrible.
it was shocking,
Yeah.
but it was the shock that I needed actually to, learn about what was happening in my own mouth and to learn to,
Right.
um, improve it, make massive improvement. So she handed me a brochure with that picture on it and walked out of the room saying she had to go somewhere else, and, I took that home and started researching
Right.
and realized that, the power to make, change significant change in my own condition, was within my hands. And
That's
I
awesome.
started applying a methodology of making sure that I could keep that pocket clean. And I would
Gary get
irrigate
it?
it, yeah, every
Yeah.
day with
Yep.
a
Sure.
subliminal pocket applicator, subgingival pocket applicator. And I felt like I was starting to get empowered because I was making dramatic change, positive change. So I went back to that
Wow.
same dentist about a year later, and, because I had waited so long to go back, she did another periodontal depth probe, and when she got to that pocket, looking at her records, she couldn't push the probe down as deep as she did the year
Right.
before,
Right.
and her rationale was, "Oh, I must have made a mistake last year," and I said, "Oh, you
Right.
didn't. Let me tell you what I've been doing for the past year." And
Wow.
she didn't have time to hear me, she had to go to the other room for another patient, and that moment actually generated within me an anger was the first
Sure.
response, "This
Yeah.
person does not wanna hear what I've been doing to make massive positive change."
Yep.
And so Will and I took that, we worked with that, emotion, and it was a couple of years later, we realized that we wanted to help other people realize that the power to improve their oral health is in their hands.
Wow.
Um,
That's beautiful.
So,
What time period was this? When was all this happening?
1993.
Oh my gosh, this is quite a while ago. Wow.
Right, but it wasn't until 2010 that we created OraWellness
Okay. Wonderful.
and started telling the world that they too can make positive change if they apply their some simple at-home natural strategies.
And Will, were you the cheerleader in this process? How did you get involved in making the change and supporting the
Yeah,
change?
I mean, I was supportive in Susan's origin story there. Obviously, it was very shocking. You know,
Yeah,
we've been
sure.
we've been alternatively minded all along. You know, Susan and I essentially raised ourselves along with her brother John and other family members
Yeah.
in the tradition of traditional Chinese medicine. Essentially, you know,
Yeah,
we studied the
sure.
Chinese longevity arts for many many years all together as young
Right.
adults. And so we were alternatively minded already.
Yep.
So the strange and I'd like to take Susan's story and just add a little bit context to it as, you know, just to layer in another piece to it. Susan had always gone to dentists. This was a new
Right.
dentist that we came to, having moved to a new town, and this person actually did, you know, was one of the early people doing periodontal exams,
Right.
which is now a customary thing. And
Right.
for anybody listening, what that exam is when you hear the dentist poking around your mouth and calling out numbers to the assistant, like 232, 333. If
Right.
they get to fours and fives, they get somber. If they
Yeah.
get to six,
Right.
7, 8, 9, or a 10 plus, which is what they got in Susan's around that wisdom
Oh.
tooth,
Oh my
then they
goodness.
get really
Wow.
serious and then it gets like, "Oh, you're going to a periodontist now," because what they're measuring is the depth of gum pockets around all of our teeth.
Okay.
And as
Yeah.
those gum pockets get deeper, they get more problematic for an individual to maintain health in those pockets. And those pockets get colonized by bacterial, you know, pathogenic pathogenic bacteria that don't just stay in the pockets. I'm sure we'll unpack that more as we get into it. Anyway,
Right. Right.
you know, so Susan, being alternatively minded, like, no, I'm not gonna, you know, and we didn't have the money to be able to do the gum surgery anyways. That was the recommended strategy. Thank goodness.
Thank
Um,
heavens, right? Yeah,
no kidding.
exactly.
Um, and so, you know, came home, did some study, started applying things, basically took it upon herself to address this and started making
Yeah.
progress and then shocked the dentist because her 10 plus millimeter pocket a year later, same pocket was measured at 3 millimeters.
Oh my gosh. That's
Now,
amazing. That's
here's
a
the
phenomenal
context I want to
change.
apply. The dentist thought she had mismeasured. The dentist was a woman. The dentist
Yeah,
thought she had mismeasured. Why? Because what Susan accomplished is a dental miracle according to
sure.
dentistry.
Yeah,
You
exactly.
can't periodontal disease is not a reversible disease within the paradigm and context of
Right.
conventional dentistry.
Right.
That's why it was such a head scratcher for the dentist and left her confounded. And the anger that Susan's respond or, you know, articulated here is a righteous anger based on, "Wait, I just showed this dentist that the model that
Mhm.
she
Sure.
functions out of is not
Right.
accurate."
Yeah.
And and she doesn't wanna hear what we have to say about it. And so,
No. No,
since
it's
the dentist didn't wanna hear, it kind of put a fire, and many, many years later, fast forward, you know, we're essentially, you know, asking God, like, okay, where's our home based business that does no harm, that we can
right.
contribute to the well being of others, that is fun and productive and fulfilling for us to work? And, you know, we kind of looked at one another and said, maybe we should talk to people about what you did with the periodontal disease. And
That's
so, literally,
amazing.
on a wing and a prayer,
Right.
we launched OraWellness in 2010, and thankfully, um, people around the world have wanted to hear what solutions we've discovered and the insights that we come up with. And now we have I, I've literally stopped counting, Morley, the list of other people achieving their own dental miracles
Mhm. Oh,
around the
yeah.
world.
I'm sure you have great testimonies.
It's beautiful. It's a
No,
really
it's
beautiful thing.
Well, it's music to our ears. I mean, we obviously we're kindred souls trying to help people help themselves, and we have this firm belief that the body can rebuild itself. What's wildly entertaining for me is just full disclosure. I'm probably the least likely person to want to have this conversation because I don't take care of my teeth. I'm really, really bad. By the grace of God, um, I got my dad's teeth, but not his psyche. My dad was a manic depressive with schizophrenia, and I'm a pretty normal guy, but I did get his teeth. I mean, I can count on one hand the number of dentists I've been to in my lifetime, and I'm 73 now. And what's wildly entertaining, and this conversation will evolve as we're having this exchange, but somehow I've been drawn into the oral health community, kicking and screaming, because apparently I'm supposed to learn. I'm supposed to learn something, but I'm also supposed to help a lot of people learn something as well. But I don't know whether John has mentioned, but I've spoken on 2 separate occasions at the Biological Dentists Convention back in 2024 in Las Vegas, and then 2025 in Salt Lake City, and they're absolutely mesmerized by the thinking and the philosophy behind the root cause protocol, even to the point where they think it might incorporate our philosophy in part of their training, which would be really cool. But I get up there and I tell this story. I'm like, guys, you don't know who I am. You're listening to me very intently, but I don't really like any of you out there. and what's really fun in the first meeting, I'm in Las Vegas. I'm like such a fish out of water, and I'm in the second row, and this very attractive woman who I didn't know, she figured she was a dentist. I didn't know. She wheels around and she looks at me and she says, "I'm going to work on your mouth someday." I said, "What?" And it turns out she's this world-class endodontist. She does root canals. She's really good at root canals. And this tooth right here is a temporary cap for a root canal that I had done when I was 11 years old.
Wow.
Yeah, I wouldn't let anybody touch it because there was so much trauma to get through that. I tripped on a friend's gate, and I fell on my tooth and broke it in half, and it was just like, oh my gosh, that was a really bad experience. But I've never let anyone touch it, and so then we fast forward 2 years, almost 3 now. It's actually almost 3, and her name is Val Cantor. Yeah, she is probably one of the finest dentists. There are a handful that I really believe in. Mike Gosweiler would be another in Indianapolis, but Val is just amazing. And we flew out here, and she said, I want you to meet some of my friends. So she put together this meeting with 15 of her MD and dental friends. And she said, but there's one condition. I said, gee, I can't imagine where this is going to go. She said, I'm going to work on that tooth. And I said, okay, what do you think's wrong with that tooth? She said, I think you have an abscess. I've sensed it ever since I first met you. And I'm like, okay. So I said, how long is this going to take? She said, about an hour. I should have known when she said about. It took 3 hours. But the amazing thing about it was she is among the finest professionals I've ever been around. And there were certain points in the procedure where she actually put her arm around me and said, "Now this is going to hurt. Just get ready for that." And it was just like I was like putty in her hands, and she was filming the whole thing because she thought I would want to watch it. And then she looked down at one point and she says, "You're not looking at this at all, are you?" I said, "No." I said, what do you think? Think this is like a YouTube video that I'm going to... And so, long story short, she did this amazing job cleaning out, and apparently there was a really bad abscess. I didn't have any physical symptoms of it, had no idea. And so what I've vowed is that That's funny. That's given her name. I vowed that I will brush my teeth every day, which I've done since I've done that. And I vowed that I'm going to use your products because you guys were very graceful to send me a beautiful box full of goodies. And I just wanted you to know that my heart's in the right place. I just don't always get my tooth in the right place. But I'm looking forward to this conversation so I really understand the importance of the oral microbiome, because it's something that's easily overlooked, that people, they think about their gut microbiome all the time. They don't think about their brain microbiome, but especially their oral. And what I've learned from these biological dentists is just how profoundly important that little cavity is that everyone overlooks and ignores.
Yeah.
And you've had this amazing transformational experience. So I'm just looking forward to learning more and making sure I can help our community key off of your community and really take full advantage of these kind of breakthrough products that you've developed. So I just wanted you to know where I'm coming from.
Thank you. Thank you for
Yeah,
the
Thank
story.
you. Mhm.
I actually
yeah,
reached out per a customer suggesting it, a member of our community. I reached out to Dr. Cantor's office saying, "Hey, I'd like to
yep.
interview you." And
Oh, she'd be amazing. She'd be
she
phenomenal.
would. Didn't ever hear back from her, but maybe with this
Uh,
head nod from you,
Oh, I'll make sure.
she,
Oh no, I'll make sure it happens.
yeah,
So here's the backstory. She did this. She did this whole thing pro bono.
mm,
So
yeah,
and I was like, I'm like that. I mean, I was really touched. But I asked her assistant. I said, so like, what did I just burn through? She said, well, it's about $5,900. I
right.
said, pro bono. Oh my God. So I sent her a thank you card and taped a gold coin. And I said, you're worth your weight in gold.
Oh,
And that
that's
just sealed the deal. So she's a graduate of our institute. She
mm,
loves the RCP, but I'll
mm,
make sure that conversation takes place because I think she would value from your products, but I think your community would just love to meet her. And she's
yeah,
got people coming all over the world
yeah.
to work with her, which is just amazing. And she
That's really the case
does
now with a lot of
yeah,
dentistry. When a dentist reaches a level of acclaim in their
yep,
field,
yep,
whether
sure.
it's Dr. Cantor or many others, people travel for good dentistry now, for
Oh,
sure.
absolutely, no question about it. So let's start at the basics. So you've got an absolute Luddite here who just has no appreciation of how important this is. I mean, I do and I don't, just so you have a sense of that. Where do we begin? What would be the most important thing for someone like myself? What do I need to understand? What do I need to do? If I don't do it, what's the downside? Let's kind
Right.
of walk people through the basics of this whole process.
I got something to say here to start this off, Will. Okay.
Yeah, please. Yeah,
I think that the first thing we need to do is to help people become consciously aware of what's happening in their mouth.
right,
And I think that it's been a blind spot for us. We go to the dentist, we sit back in the chair, and we
right.
let them tell us what's going on.
Absolutely. Yep.
And I think that we can switch the role of that, become our most valuable player ourselves, and learn about what we have going on, and then um, decide to apply consciousness while we're brushing our teeth, while we're flossing
Sure.
our teeth.
Yep.
Right.
That's
And because
very well
that's just going
said.
to give us a lot of information. You can floss between a couple of molars and smell it and know that you've got an active infection going on. All right.
That's
So
right.
I would say that's the first step.
No, that makes a lot of sense. And we're really good at denial. Like
Yeah.
even if you're flossing and you smell it, you'll say, well, it can't be that bad. And but
Yeah.
the thing for me though was I had no symptoms, none that I was consciously aware of. But
Right.
as soon as she looked in my mouth, she knew right away she had to do something. It was just, and again, that's the mark of a true professional who can really fine tune their powers of observation. So no, I think that's a great starting point. Makes a
You
lot of
know,
sense.
let's piggyback off of that, Morley, with just, your segue into this conversation, sharing your story about your tooth. Um,
Yeah.
First of all, Dr. Cantor may have added years to your life by addressing that
Right.
abscess.
No
Okay,
kidding.
so I'm just
I'm
gonna lay
that's
that
right.
down.
Right. Absolutely. Yeah.
Here's the thing, okay? to Susan's point, one of the realizations that we've made through the years of studying to support our community is that we have our culture. We all carry these cultural blind spots, or what we call a mental disconnect with our mouths.
That's right.
And we are essentially victim to cultural myths that I think your origin story with your tooth kind of highlights that I just want to touch on here, which is
Yeah.
one of the myths is that if that to navigate the path to optimal oral health is essentially a hygiene issue, and that all I need to do is what? Everybody can sing this chorus together. Brush my teeth twice a day for 2 minutes, floss daily, use fluoride. It's the same cultural narrative we've been
Right.
taught for a long time.
Right.
We can't hygiene our way to oral health. It's not a hygiene factor. Okay. So I would say that the number one thing that we need to do, if there's anything to do really, is to heal ourselves, our minds from this mental disconnect with we have with our mouths,
Yeah.
and reveal basically myth busts the cultural myths that we have, and approach oral health from a different paradigm, from a different mind frame.
Right. Yeah.
That's
Makes
what's to
sense.
be done. Once we grasp, oh, wait, some very simple cultural myths, like one of them Susan touched on here, which is if I go to the dentist on a regular basis, they're going to help me have optimal oral health.
Right. Yeah.
The
Sure.
dental model is not designed based on giving us oral health. It's based on treating disease, which your community knows very well. There's a far cry of difference between treating disease and creating health.
Absolutely true. Yeah.
Okay.
That's right. Yeah.
So shirking and foisting the responsibility of our oral health onto the dental community is not the answer. We need to awaken from that myth and be like, hey, you know what? It's up to
Yeah.
me. If it's to
Yeah.
be, it's up to me.
Exactly. Yeah.
Because at the end of the day, and if we go back to Susan's origin story, some of these bacterial colonies, these pathogenic microbes, they double their communities every 20 minutes. They're able to reproduce and double their numbers every 20 minutes. So my question that I frame to anybody listening to this is this. If you go to the dentist every 6 months or even every 3 months, okay,
Yeah.
like you're in advanced periodontal care, how on earth is that treatment every 3 months supposed to address a bacterial colonization that is doubling every 20 minutes? It can't.
Wow. That's incredible. Yeah.
It can't. And that's
No.
why dentistry, by and large, says periodontal disease is not something that we can treat and manage. All
Right.
we can do is manage the symptoms, and it's not something that is healable. Well, what they're forgetting or what they're overlooking and what they're not used to seeing is an empowered person or patient or public who
That's able to
says,
reverse that. Yeah.
okay, I've got to take this on my own shoulders. It's not rocket science. I can apply simple protocols and navigate this path. And you, Mr. and Mrs. Dentist, are my expert helper. I don't expect
Yeah.
you
Right.
to do this. I want you to give me educated feedback of what you see in my mouth because, and here's part of the mental disconnect, because it's tough for me to see what's going on in my own mouth.
Yeah. That's true. Very true.
So I would say that to begin, for anybody listening, it's to question the narrative and the myths that we hold to be true around the path to optimal oral health, and realize that while not complicated, we do have to open our eyes to the biases that we have from what we've been taught, what we were taught as kids. And I'll
Absolutely.
give you just like,
Yeah.
I'll give you just one kind of litmus test, if you will, the idea of awakening from this mental disconnect that we have with our mouths. And I'm not going to put you on the spot, Morley,
No.
because
No.
you're the guru here. But I will put anybody listening on the
I'm a
spot
guide.
of this.
I'm a pretty
Yeah,
good guide. I don't know if I'm a guru, but that's okay.
Well, I use
Yeah.
that term loosely.
Yeah.
I totally agree with you. We're and that's why we're actually cut of the same cloth, because We don't consider ourselves gurus, we're
Mhm.
guides.
Yeah, exactly.
We're still figuring this out. This is an
Absolutely.
ongoing
Yeah.
process. But here's the litmus test that I would just pose to anybody listening to this. Without counting actively, how many teeth do you have in your mouth right now? Just like, and if you're not able to say, oh, I've got this many teeth in my mouth, that is highlighting for you right now, if you choose to see it, the relative mental disconnect we all have
Right.
until we say, oh, wait, yeah, I need to know what's going on in my mouth.
Well, I think I'm supposed to have 32,
That's correct.
and I had 4 wisdom teeth taken out that were supposedly impacted. And
Right.
at one point during that procedure, there was this sudden rush of warm fluid, and suddenly there were like 16 hands in my mouth. And I looked up and I said, "You didn't make a mistake, did you?"
Oh,
but
no.
but the reason why I know about the 32 is one of my favorite uh, stories is about Weston A. Price, who I'm sure you're
Mhm.
very familiar with, and wanting to understand what drove him to do that research. Well, there
Mm.
were actually 2 things that really motivated him. One, he knew that when the fetus is developing, there's 32 buds that split, and then they become 64 buds, and 32 become our teeth. And then the question is, what do the other 32 become? And it's our spine. And he knew that perfect teeth then perfect spine, then perfect health. And that's what really drove him. Now, what really galvanized him and his wife Florence was that when his son, their only child, was 12 years old, he gave him a root canal. And he got an infection from it that lasted for 4 years. And then the son died. And that's what really drove him to go around the world looking for perfect teeth to say, what are we supposed to eat in order to keep our body healthy, but more importantly, our oral cavity at optimal. And I'm sure you know that side of the story. But yeah, I think it's 32 total, but many of us probably have the missing wisdom teeth.
Sure.
So,
I want to piggyback off of that, Morley, if I may, your story about Weston Price. I know that this has been, I believe, a little bit culturally blended, 2 different stories here. I was aware of the fact that he had worked on his son's mouth and that his son had died. I believe that that has been combined with another story out of Weston Price's work that I think is important to kind of highlight here and bring forward the mouth-body connection. One of the experiments that Dr. Price did, I mean, he's most acclaimed for traveling around the world and studying indigenous
sure.
people and their diets and
Right.
their dentition.
Right.
But one of the studies that he did, one of the experiments that he did, he got a tooth from a person who had died
Mm,
from heart issues,
right. Yes.
and he took the tip of that tooth off, the root tip off of the tooth, that infected tooth, and he said, this is what he based his focal infection theory on. And he took the tip of that tooth and he embedded it under the skin of a rabbit,
Hmm.
and that rabbit died of heart disease, of heart issues.
Right.
And so he took that tip of the tooth out of rabbit number 1, now deceased, and put it under the skin of rabbit number 2, and that rabbit died of heart issues. He repeated this many times, and they all established the same issues. So the question that I have is, if it's literally cultural insanity, I believe, at this point, Morley, and you deal with this as well, I'm sure, in your community,
Hmm. Yeah.
that we can th we mentally bypass the fact that the mouth is the primary gateway that we put everything into our bodies,
That's right.
and yet it doesn't dawn on us that it is a huge pathway into the rest of the body. It's like we
Uh,
have this disconnect, like the mouth, and this is really one of the cultural myths that we've really brought forward with the interviews from other experts that we've done for, oh shoot, over a decade now, going on 15 years. um, is this: the Western medical model, which includes dental model, is very, very hyper reductionist. It
Mhm.
over compartmentalizes the body. The dentist doesn't talk to the fill in the
No.
blank of any other medical professional. And despite the fact that, by the way, us parsing up the body into parts is is just a model.
Oh, absolutely. No, that's very
If we
true.
function as if that's a reality and not just a model,
Right.
then we really miss the forest for the trees, because at that point, we're forgetting the fact that the mouth is the headwaters to the entire gastrointestinal system. It
Mhm.
maintains, it is the pathway into the predominance of our immune system. It's
Absolutely.
just, it's literally like we're insane because we just haven't realized, like, oh yeah, of course the mouth is important for my whole
Right.
body health.
Right. Oh, yeah. No, I mean, that's what was so powerful when I was doing those presentations at
Mm,
the biological dentist. I I never had thought there was a connection, but it's
mm,
inescapable to be in a room with 500 professionals who are there because they believe in that connection. It was a
yeah,
total immersion into that consciousness. It was very, very powerful, and really, it was a real shift for me, both personally and professionally. It was
yeah,
amazing. So shifting the consciousness, that's huge. That's not an insignificant starting point. Um, what's next? What do we have to do to really begin to build on that and then make that a part of our the central part of our lives? How do we do this? And and I'm going to use words that I'm not trying to offend. But it's like, how do I do this and not make it onerous? Because it's like
right,
it's a pain, to be honest. For me, it's like I don't know why. There's so many things I'm disciplined about, but I don't have that same respect, and I don't know what it is. Maybe it's a familial thing. I don't know, but it's just what I want to do is now later in life is adopt the right attitude. I think I'm there, but it's like, how do I make this so that I can build on that and really captivate and capture the benefits of that?
right, right. Susan, you want to start?
Well, what's coming to me now is basically, so our conscious awareness has been born, right?
Right?
And then it's a decision to take responsibility or
Yep.
to give our power over to someone else who cannot
Hmm.
attend to us every day, right?
No,
So
that's right.
you touched on it with the idea of discipline, but I think it has to also be kind of an awareness of I'm treating myself with this. I'm doing something good for
Mhm.
myself. And that
Right?
is going to generate a desire to continue, right?
Right.
And I mean, really, we're just talking about, what do I do when I get up in the morning to get ready for my day? And do I apply conscious awareness as to my mouth as I'm brushing my teeth or,
Hmm.
as much so to, what do I drink first thing in the morning and what do I eat and, what supplements do I take, right? A part of that is the daily application of attention to our mouth. And then you've got the idea of okay, so what products am I going to use?
Right.
What techniques
Absolutely.
am I going to apply,
Right.
right?
I mean,
So,
we put so much time and attention into the clothes we wear, thinking that that's important. And to some level it is, that first impression, but it's like there's nothing more powerful than to see a beautiful smile. And it's
Mm,
just, and we don't think
right.
about it. I don't always think about that, but I'm much more conscious of it now. I think the gesture that Val made was to say, you're worth this investment. I
mm,
think no one had ever kind of expressed it that way for me. And it was a real shift in my awareness when that
yeah.
Yeah.
process unfolded.
So there's
You know,
the self-consciousness too, right? Of, hey, I want to have a beautiful smile, but there's
Right.
also the smell of our breath, which
Right.
many people go totally unconscious about, right? And a lot of people just become what self-conscious or even
Mhm.
embarrassed, will cover their mouth or something like that because they're aware that there's a odor that's coming out that is symbolic of pathogenic bacteria overload, but they're
Right.
not calling it that,
Right. Yeah.
and there are things we can do that we have to do ourselves because of the rapid rate of proliferation of the pathogenic bacteria,
Yeah.
that we have to do at home.
Yeah. No, it makes so much sense.
And if I can touch in on this, the way that I think about this is, I've kind of already said it with the whole idea of myth busting, Morley, but um, it's about shifting our minds. So, like you were saying, like, I'm just not very disciplined with caring for my oral health. I want to be. What should I be doing? And so, bear with me here as I describe this model. And this, I can't take credit for this. This is originally from a guy named Simon Sinek, who did a TED talk many, many years ago on this subject that's called Start with Why. And so if you imagine concentric circles, right, with the
Right.
centermost and then outer and outer from there, most of us, like if we go to the idea of oral health, we focus on the what level, which is the most superficial level, which is what should I brush my teeth with? Which
Right.
is why,
Sure.
I mean, it's kind of funny that we're an oral health product and information company. Sure, we sell products, but that's not really our driver. Our
Right.
primary issue here is to educate the community and the world that we can create positive change if we apply ourselves. So
Yeah.
let's, if we think about the what level, which is where the culture tends to want us to focus, then we're not really getting to the core of the issue. We're not getting to the root
Right.
or the root cause of the issue. Okay.
Right.
So in from what level is how, and in from how level is why. So again, I'm gonna frame a question for anybody listening to just contemplate for a moment. Like, why do we brush our teeth? Well, because I was told to as a kid, and that's not a good answer. Why do I brush my teeth? Because I want fresh breath? Okay, yeah, because, well, you're just supposed to, like, but stripping all that away, really, because if we don't understand the why,
Right.
then we're not gonna understand how to do the why well,
Right. And that's going to
and
do
we're
the
not
what.
gonna understand what we should be using to accomplish the why,
Makes perfect sense. Yeah.
right? And so my version, what I've, and again, I'm a life learner. I don't have all the answers. Oral wellness doesn't have all the answers. We are actively exploring the front edge of our insights that we've been at doing for now, since I think it's the early 90s that Susan first started on this path.
Right.
And here's what I've come to as far as why we brush our teeth. We brush our teeth, or we should be brushing our teeth, because we are looking to be a good conductor of the symphony of microbes in our mouth. We're looking to be a good
Interesting. Yeah.
steward of the oral
Right.
microbiome.
Right.
Okay, so if our job is to be a good steward of the oral microbiome in our mouth, then how might I best apply strategies to accomplish that why?
That's
Okay,
great.
so if
Great
my North
approach.
Star, and I'm going to tell you right now, folks that is listening, that's really where, in my opinion, with any oral hygiene we apply, we should be focusing on that North Star. Why am I doing this? Because I want to create a good environment in my mouth for health to exist and flourish. Because there's no amount of dentistry that can create optimal oral health. And I'm going to tell you right now that hygiene is not the answer to optimizing your oral health. It's a part of it. It's a strategy to help us achieve that. But we have to create the environment for oral health to flourish.
Yeah.
Okay. And the strategies that we use and how we apply those strategies are crucial. I'll give you a really good example that we've used for years. The first video tutorial we made, boy, if you really want to see a terrible video, it's like over 15 years old now. It's like,
Yeah.
so granulate, it's terrible compared to what we can do nowadays.
Sure.
And what we're used to. But we made a video called How to Brush Your Teeth to Reduce Gum Disease. And what we did is we highlighted a story of Dr. Charles Bass. If I give you a little bit of history here, Dr. Bass was actually a parasitologist. He was an MD, studied parasites. He was the first Westerner to carry a microscope west of the Mississippi River, just to give some historical
Wow.
context. Okay. And Dr. Bass was, he went to his dentist. His dentist said, "Ooh, you have periodontal disease. It's time to pull all your teeth." And like Susan, he said, hold up. No, wait. Let's not go down that path yet. And he went back to his lab. He had a microscope,
Yeah.
and he took plaque samples and was one of the first people to identify some periodontal microbes. And what he did is designed a brushing technique through empirical evidence of trial and error. He developed a brushing technique in a toothbrush that helped him lower the numbers of
Wow.
pathogens that he could
That's
find on
amazing.
his microscope out of his plaque samples. Okay.
Right.
So we made a video, 15-ish years ago now, called How to Brush Your Teeth to Reduce Gum Disease, focusing on the how level. Because, and I'll just throw out one other thing for somebody listening to just check themselves on the next time they go to brush your teeth. If you use a manual toothbrush, which a lot of people don't these days, but if you use a manual toothbrush, the next time you pick up your toothbrush, notice how you pick it up and how you brush your teeth. Most of us brush our teeth like we were toddlers still, honestly. We brush with a full fist, like this. You can see. But if I hold, like every toddler in the world, you see, like, okay, Johnny, brush your teeth. And he grabs his toothbrush and now he's scrubbing the grout line, right?
That's
If
funny.
you hold your toothbrush like you're scrubbing a grout line, you're going to overbrush your teeth and you're going to cause loss of enamel over the course of your life.
And you're going to
This
torture
is not
your
a
gums.
compliment.
Yeah,
What's that, Susan?
exactly.
And you're going to torture your gums.
Yeah,
That's
absolutely.
right.
We're not scrubbing a grout line,
Yeah.
right? So what part of the Bass method, the Bass technique that Dr. Bass developed, is to hold the toothbrush like a violin bow.
Oh my gosh, that's
Okay,
beautiful.
this
I
way,
love it.
not this way. So when you pick up
I'm
your
more like
toothbrush, yeah,
Tommy than
yeah,
Yeah.
and we all,
That's funny.
until we
Oh, that's so
awaken and like,
funny.
oh wait, it's kind of like this. Like, what other habit do we do theoretically every day that we learned since childhood that we never went to revisit that
Exactly.
strategy? That's like
so
picking up
true.
a crayon to
Right.
sign your checks. That
Yeah.
doesn't work.
Oh, is that a bad idea?
Yeah.
No, that's a beautiful point. I love it. That's so funny.
So what I would say is get a grasp on why. Okay,
Yeah.
why do I need to take care of my oral health? Why do I brush my teeth? And once you understand the why, which is not hard,
Yeah.
we provide lots of free information on our site.
Yeah.
Once you understand the why, then you can go, okay, all right, if I want to be a good conductor of the symphony of microbes in my mouth, how might I do that?
Right. Right.
And then what tools or products, now we're out to the most superficial layer, really. What tools or products are going to optimize my ability to accomplish that?
Right. That's so true. Very, very simple, but very powerful model to get people to the right space.
It's just a shift of mind, mostly.
Yeah,
really.
Absolutely. That's amazing. And so, what I'm also thinking about is, and that's a very powerful reminder of how to hold a toothbrush. That's pretty basic. But I think what's fascinating to me is, at least in the world that I've danced with these biological dentists, is how little they know about the biochemistry and the physiology of our mouth, particularly from a mineral standpoint. That they had no idea that the pathogens lived on iron. Had no idea that that was a prerequisite for all the pathogenic bacteria, not just pathogenic, but especially pathogenic. And the fact that there is this fascinating dynamic between two metals, copper and iron, they had no awareness of that. And I don't think the average person does as well, but it's so central to the mechanism of the RCP is to get people to realize that you can take control of this process. And it's through very simple techniques like what you're saying with just holding the brush just right or knowing, what nutrients are really critical. So I think it dovetails so beautifully with our message in terms of trying to bring people into this. It's fascinating. It's so close, but yet so far as part of their awareness. And I think a lot of people are very they're probably very mindful and disciplined about brushing their teeth, but I don't think they know why. I think I think you really touched on it in terms of helping people really reinvest the why is so powerful to get them just to appreciate what the value of the process is.
I think that it can really help us head in a very different direction
Oh, totally.
and
Yeah.
awaken from the cultural myths and that really well, I mean, here's the thing, okay? Here's a sad statistic for your community. 97 out of every 100 men, women, and children in the United States, and the US is no different than any other, like, in fact, a
Right.
lot of very quote unquote poor countries have better rates of this than what I'm about to describe. But 97 out of every 100 men, women, and children in the US have some form of active oral disease.
Doesn't
Okay.
surprise me at all. Yeah.
No. Tooth
Yeah.
decay and gum disease being the lion's share of those 2, of
Right.
course, but
Right.
97 out of every 100. So the question is this: if what we were doing as a culture were working, don't
Right.
you think that that number would be much lower?
Right. Exactly.
So we've got a broken system. So what that means is if we do what we've been taught, we're going to
That's
end up in the same place as a sad
exactly.
statistic.
Yeah. Can't solve the problems using the same thinking.
Correct.
And just to build on that, there was a major study done at UNC, University of North Carolina's Gillings School of Public Health.
Mhm.
This was in December of 2019. Very bad timing to be releasing an important paper, but it was a wonderful expose into the fact that 93% of American adults have some form of metabolic dysfunction.
Oh, yeah.
And so it's just building, it's the same concept, just applying it more broadly to the body, but wouldn't most of that start in the mouth? And it's just to think about the connection between the two is so important for people to appreciate that.
Yeah. Yeah, I think that you're spot on it there, Morley. I think that we have um, a lot of overlap in what we do.
Oh, totally. Yeah.
Um,
Yeah. But
you know,
both in terms of philosophy, especially the education is the focus. And oh, by
yeah,
the way, we happen to sell products, we don't really tout the fact that we sell products. It's available. We have a product listing, things like that.
right,
But our real emphasis is education, and very
right,
lockstep with what you all are doing
yeah.
as well.
I think that I can describe your business model because it's our own. Here's the business
Yeah.
model. It's really complicated, everybody. You ready for this? Here's some helpful information for free.
Yep.
If
Absolutely.
you find benefit from it, you might want to check out the products that we developed to support this premise and this model.
That's very true. I think what we've done is we've added a couple steps. If you want to be part of our community, pay a few bucks a month, and every
Sure.
2 times a month we have a chance to have a hoedown, ask questions, get answers, and then of course we have the training, and
Mhm,
that's been a real important avenue for us to break through the scotoma that
mhm,
that that we can in fact take control. And again, what's amazing about our attendees or the people that go through that training, a third of them are moms.
mhm.
A third of them are people like you and me. You know, the three of us would be great candidates for the training. We don't have a professional degree. We just care. We want to
Right,
help people. And a third of them are professionals. And
right,
what's fascinating about it is that ordinarily professionals do not like to mingle with the peons, right?
right.
But in the world of minerals, we're all the same. We know nothing. And so everyone's on the same plane, and we're all here to learn. And it's a very powerful venue. But no, your business model is absolutely identical. Absolutely
Yeah,
true.
yeah.
Um, and so I'm curious now, given that that education is first and foremost. Do you have a series of educational videos that you take people through that that you can tap into? And forgive me for not knowing. I mean, I probably
Yeah,
should know the answer to that, but what I'm
yeah,
trying to do is divulge my my known weakness, but really approach it as though I'm here on behalf of the community. I don't know anything
right.
about this. Bring me up the learning curve so that our community can really take full advantage of this
Sure.
juggernaut that you've all have assembled.
Well, so we unpack this through the years of just exploring it and discovering
Yeah.
insights and like, oh, this is really important. We create a new video tutorial. So we have a bunch of different tutorials on our site. It's all
Yep.
free. We um gosh, back in 2012, we did a summit back when summits were really just first getting started.
Right.
And
Right.
it was a paid thing and blah blah blah. And then we realized, what, this information is too important. Let's just put it out to the public for free.
Mhm. Right.
You can come listen. The video quality is really poor, of course, because it's a dozen
Right.
years
Sure.
old, but
That's right.
the information is timeless. It's still just as helpful today as it was back in 2012. Um, that's all free. I mean, we've got a lot of hygiene stuff, like, the example I gave of how to brush your teeth to reduce gum disease. We cover, for example, why flossing is important. A lot of people don't
Right.
like to floss. Um, and
Because
and I think
I
that
always bleed. I always bleed. It makes me uncomfortable when I see my bleed.
right.
And
And
now
so
I
what
know
does
why
that
I
mean?
bleed. Yeah, no, now I know why, and Val was able
Right,
to explain. So it's like,
right,
okay, shift them in awareness and consciousness,
right,
but
right,
I resisted it for a long time.
right. So I wanna underline something here. Just, thanks for sharing that, Morley. And that's really for us a litmus test that is a very much of an easy yes no question. Like,
Yeah,
and that's really where we anchor. Is like, when you floss, if you don't floss, go floss. And what we call is conscious flossing. Notice what happens at each of your contacts between your teeth.
yeah,
In other words, if we're going to heal this mental disconnect, it's not difficult. It just
right,
takes a little bit of focus while we're doing these
right,
oral hygiene strategies that, and bring adult conscious awareness to an activity that we learned when we were 3 and 4 years old.
right.
So if you get blood on your floss, that is an undeniable, like, yes, no answer, whether you have an active infection there.
There you go. Right.
And if a person has an active infection, I'm going to tell you right now a story that is not to put the fear of God in you, but is to rattle your cage and awaken you to the connection between oral health and systemic health.
Yeah,
Okay.
that's very
So bear
powerful.
with me here for a second. Let me just tell about this because this is such a
Uh,
profound
uh,
study.
I'm going to
Um,
put my seatbelt on now.
there was a cohort study done back in, I think it was like 2011,
Yeah.
and they took 300 people, all with elevated CRP levels. Okay, so they were
Hmm.
all quote
Right.
unquote at risk for heart disease.
Okay.
Okay,
Fair enough.
and your community and CRP better than I do. I mean, I learn stuff from John when I can, but
Right.
for the most part, my understanding of C-reactive protein is it's a better judge of whether a person is at risk of heart issues than um, blood cholesterol, which is a whole nother rabbit hole we
Oh,
won't touch.
totally. Yeah,
Yeah.
that's right.
Okay. So CRP is an inflammatory signal in the blood that we can test very well. It's a relatively good judgment as far as inflammation in the body. So they took 300 people with elevated CRP levels, and they decided to do a lifestyle modification study. And they said, all we want you to do, don't change anything in your life, except we want you to floss at least once
Mm.
every other day.
Wow.
Okay. So floss once every 2 days at a minimum, once or twice, once a day is fine. You don't need to floss 5 times a day. That's excessive. Just, at least every other day. Okay. And then in 6 months, the people who completed that came back and had their CRP levels, and they all had dropped into normal ranges.
Oh my gosh. That's
Okay.
amazing.
Now, as
Wow.
profound as that is in and of itself,
Right.
The study, the people doing the study did not stop there, thankfully, and they said, "Okay, that's great. Now, stop flossing."
I love
And
it.
the
Yeah,
people who stopped flossing and came back and had their CRP levels tested again,
they went up.
the CRP levels had gone back up.
Oh my gosh, that's amazing.
Okay,
Wow.
so they didn't do this as a double-blind placebo, so we
Right.
can't say that there's a causal
Yeah,
inference here, but
right.
I I'm not I'm an armchair scientist, not a
I know,
scientist.
right? Exactly.
I'm
Citizen
like, the
scientists, right.
handwriting's on the wall from that, folks.
Yeah,
Look, if you floss, like, again, and we cover this in our Why We Floss video, again, going with that why, how, what model. Why do we floss? Oh, we floss to protect from getting tooth decay between our teeth. No, that's been debunked. That's not true.
wow.
We floss to be a good conductor of the symphony of microbes in our mouth. And one of the places that we really have to pay attention to is between our molars, because if we don't, then we are adversely impacting the entire system downstream from our mouth.
Right. Do me a favor, send me that study
Sure.
if you have access. That's a very powerful, dose of reality that I've never
Yeah.
heard. No, I mean,
Yeah.
I'm a student of CRP. I know that inside and out. I've had one client who had a CRP of 18. I thought she was gonna have a heart attack on the spot.
Yeah.
And, the little known fact is I think the C in C-reactive protein is referring to copper.
Mhm.
And what people don't know is that copper works best when it's bound, and it's in its protein ceruloplasmin
Okay.
that's made in our oral cavity, by the way. There's 10 places
Uh,
where it's made,
oh,
and so it's very important to be able to measure. I would love to be able to measure it in our mouths as well. But when the copper comes outside of its protein, it's more reactive.
right.
C-reactive protein. And so,
Interesting.
yeah, and what I've also read is that it tends to be more related not just to inflammation, but to an infection. But I've never known it to be connected to oral health. That is a mind bender, with dozens of folks. I mean, I've done 400 YouTube videos, but there's a baker's dozen of people that's just really been fascinating. You guys are just blowing my mind. So I should have known with Susan's connection to John that this would be an amazing. But the two of you together is just it's such an absolute treat to have this
Oh,
kind of exchange. So thank you. So now, what else do we need to know? So I think what has surprised me is um, just how, and this is going to sound really naive, but it's just how important this discussion is, and how important getting people in the right frame of mind about their oral cavity is. I mean, I knew when I was invited into that domain with the biological dentist, there was a shift that was occurring in my world, because at no point in my life would I ever think I would stand up in front of a group of dentists and tell them and try to educate them. It's just like, why
right.
do that? But
Yeah.
this has been such an unexpected pleasure. But then to have this kind of discussion to understand, you have answered my why. Why do I need, even when Val was telling me, you got to do this, I'm going to teach you how to brush your teeth. I'm thinking, why do I need to know that? Right. And then you grab that brush and I'm like, well, that's me. Okay. You've changed my life. I mean, I'm very very grateful. So tell John we're even, okay, Susan? Because I think he likes to think that I've saved his life. Well, now you've saved my life, so I think we've leveled the score here. You're like the common person's connection to Weston A. Price. You've brought Weston A. Price down to
Wow.
an accessible, understandable level. So I commend, because he is one of my all-time heroes
Mine too.
for a wide variety of reasons. But I think what you've done is you've brought down his genius so that we can all not just understand it, but use it and apply it. So I really can't wait to have the continued dialogue of this, but to share what I know with your community, which I mean, I can see the symmetry here is just amazing. So I'm really very, very excited about it.
You just gave me a huge compliment, Morley. Thank you.
Well,
You just
no,
reflected back to me what I considered to be a gift of mine, which is to take a complex subject, digest it, and turn around and parse it up and share it so
Yeah.
that more people can benefit from the information. And
Well, you,
you
well, you
just
did
fed it right back to me.
you did it when you grabbed the toothbrush. That was an act of genius. That wasn't just a random. No, I that you have no idea
Well,
how
I
you changed my psyche on that one.
Well, so to be true, I'm down here on my desk and I keep a toothbrush on here because this is also
Right.
my video set. And
Oh, that's
for
funny.
all videos, I hold this in my hand because as I'm talking, I'm very animated
Right.
with my hand. And then I get into the conductor of the symphony of
Yeah.
microbes
Sure.
with the toothbrush.
I don't have a cool tool like that. I'm just like I use words. I don't get a chance to use a toothbrush.
Wait.
Yeah.
You need a copper rod.
There. Oh. I like that. There we go. All right. I like that. And I could use that in many ways, right?
Yeah.
Whack people when they're not right.
It really is an elephant in the living room in our culture. And we have,
Yeah.
we're really proud to be a part of the conversation to broaden the awareness that our oral health plays a critical, fundamental, I would say central role in the health of the whole body.
Well, and again, it's building on. Again, I'm sure you know the story. Weston A. Price did the research. I don't know whether you've seen the 2-volume series of his Root-Canal research, which is
It's
really
on
frightening.
our bookshelf
Okay.
here. Yes.
Okay, it's really scary. I've got it at home, but all of that research was put into a chest, and then it was given to Hal Huggins. I mean, it's just,
Yep.
and I only met. He was just a very influential figure, as you know.
Mhm.
But he wrote the book. It's all in your head.
Mhm.
And his observation was that 80% of people's health problems start after they go see the dentist. And it's like, when I heard them say that the first time, I thought, wow, that's so profound. I mean, and like you said, it's part of this gap in our consciousness about the oral community or oral cavity. We just don't even think about its impact on our body.
Yep.
So yes, folks, there is going to be, this is a phenomenal part one. There's going to be an even more phenomenal part two. And then we're going to spend some time together and we're going to share our perspective within the RCP for their community as well. So this is going to be a real delightful exchange of ideas and concepts. So I look forward to that.
Yeah.
Yeah.
Cross-pollination of cultures, if you will.
Exactly. Absolutely. Any thoughts in closing that you want to share with people? Don't grab that toothbrush again, please.
Well, it's been a real pleasure to have this
Yeah.
conversation with you. Start
Oh,
at the very
absolutely.
beginning,
Yep.
get our head right on who's responsible for taking care of ourselves.
Absolutely.
And then we can, we can share with people, some of the cool and fun products that we've come up with
Right.
to help this process be an enjoyable one.
Well, yeah, and just to see the value of it, just to really find appreciation in it. It feels, again, because of just where I've been, I do it out of obligation, but I don't know. I think today was the first time I've understood why it's so important. And when you shared that CRP study, it's like bong. I mean, I've done a lot of research on CRP. Had no idea it started in the mouth. Had no idea that there was that connection. So, and what's really entertaining is my middle name is Matthews, and that's the branch of my family tree that I take after. And so my mom, who was like the Matthews, died of her third heart attack,
Mm.
and her mom died of her third heart attack, and her dad died of his second heart attack, and his dad, his name was Hugh Matthews from Cornwall, he died of his first heart attack. So I know how I'm going to go out. But what I've been doing is trying to push it off as long as possible. I would never have thought that brushing my teeth was part of that strategy, but now I understand why and how important that is.
I'm gonna, I've got something poetic to say, but I think I'll save it for our next part two to this. I'm gonna close with this. There are 3 vectors of contamination for the microbes in our mouth. Okay.
Okay.
Just because your history, your family line all had heart issues and died of heart attacks
Right.
does not necessarily condemn you to the same fate. Maybe, yes, eventually, because there may,
Right. Sure.
there can be hereditary, genetic components, but I would also say that there is a propensity towards, I'll use loosely, culturally genetic components, which is this:
Yes. Yeah.
microbes that are passed to us from parent to child, which is a primary pathway that these microbes are passed. We get them
Yep.
through 3 vectors of contamination, folks. We call them parents, partners, and pets. Okay.
Wow.
Number 1, don't ever let a dog lick your child in the face or your grandchild in the face. It's a terrible habit. I know it's adorable. Don't do it. It's a really bad idea. Okay. So dogs are one of the carriers of gum disease pathogens.
Yeah.
So if you take care of your oral health and become a good conductor of the symphony of microbes in your mouth, then I believe you are going to stop one of the primary vectors of inflammation into the body, that there's a direct connection between oral health and heart disease. Just
Yeah,
like there's a
absolutely.
direct connection between oral health and brain issues and neurodegeneration and,
Or leaky gut.
Absolutely.
you
That's
name
right.
it, because
That's
the
right.
mouth is the headwaters to the entire system.
Makes so much sense. No, that's great. Well, this has been a life-changing exchange. Thank you for taking the time.
Thank you, Morley.
Job well done. Thank you.
Very
Thank you
much.
so much for having us. We
We'll
look
talk
forward
to
to
you
talking to you
soon.
again.
Okay. Thank you so much.
Bye-bye.
Okay.
Thanks very much for watching all the way to the end. If you like this content, we have 2 other recommendations. And don't forget to subscribe and like the video. And if you have some other friends and acquaintances that you think might benefit from the information, please share it with them.